I'm Dr. Brian Handal. I'm an orthopedic spine surgeon out in Des Moines, Iowa. Currently in private practice, which involves mostly degenerative and complex deformity and revision spine surgery. I trained at the Florida Orthopedic Institute, where we basically did a lot of minimally invasive procedures, but a good portion of it was revision and complex deformity. I would summarize my experience with Catalyst by simply describing the word versatile. When I first started practice, I needed to choose a graft that I can use in multiple procedures, from cervical to lumbar to simple degenerative to complex deformity. In my hospital system, cost was of the utmost importance, and so I had to ensure that I was not only being a good steward of resources for my hospital, but also being being an advocate for my patients and ensuring that I had the best fusion possible. The three words I would use to describe Catalyst as one that I've already used, which is versatile. I can use it in multiple procedures, anterior, posterior column reconstructions. I can use it in the cervical spine, anterior, posteriorly. Durable. It is great in its packability. It does not extrude into the soft tissues, and it stays exactly where you put it. And then reliable. I have great fusion rates. When I first started practice, I was getting CTs on a lot of patients just to follow up on specifically Catalyst's performance, and it was, sensational. The result that impressed me the most regarding Catalyst is obviously its fusion rate, but I think you can say that about multiple products. I think what has also impressed me the most about Catalyst is simply how packable it is. I do a lot of MIS procedures that require tubes and funnels, and it was very, very difficult for me in the beginning to find a product that could get down into these small spaces and then redistribute where it needed to go. And Catalyst has been instrumental in all of these procedures now for me. What excites me most about having Catalyst in my toolkit is its simplicity of use. When we start a case, there's not any rush for my staff on the back table to try to prep anything for the graft. It comes in a syringe, it's deployable immediately into my hand, and then I'm able to mold it to whatever I need in that particular procedure. As a spine surgeon, plans change. I have A, B, and C in that particular procedure ready to go, and I'm still able to implement OssDsign at that time, and I can deliver it which way I need it, depending on what I have in my armamentarium that day. There are many successes that I attribute to Catalyst, one of them being fusion. I have switched over most of my grafts to Catalyst in the posterior gutters, the intervertebral space. And when I look at my patients post-operatively upwards of 6 months, I have great fusion rates for all these patients. And now that I've only specifically used Catalyst, I attribute it to Catalyst. Catalyst has impacted my confidence in doing procedures because when we deliver, for example, an intervertebral device, I know that it's a race between hardware failure and fusion. And I can rest assured with confidence by utilizing Catalyst in those spaces that I will always be relying on the side of fusion. Yeah, I've actually had multiple colleagues come to me and actually ask me about Catalyst and how I particularly use it. The first thing I talk about is the handling properties of it, just because it's so moldable. One of the way I use is actually placing it on the facets itself and not just on the posterolateral gutters, and it will stay there. I can place saline over it, it will not wash out. And then when I close the soft tissues, it is not going to roll away. It's going to stay exactly where I want my fusion to be. And so that is one of the more distinct characteristics of Catalyst that I described at first glance. I utilize Catalyst for all of my challenging cases. I do a lot of complex deformity. A lot of my practice involves revision and flat back. posterior column osteotomies. And so I use it really judiciously in the anterior and posterior columns. And I get CTs on these patients, and they have great fusion, and it's been very, very reliable. Integrating Catalyst into your surgical workflow is very simple, and you can, since it's so moldable and you can handle it very well, it can fit into any space. I use it a lot in funnels. I place it with other grafts. It plays nice with other grafts if you need it to, but overall it is very, very user-friendly, and there's no setup required. It comes right out of the tube. It fits right into your hand. It goes right into the patient. There's no setup time required.